they have a regional resource that really is comparable to any resource in Boston in terms of trauma care.
Without the travel time.
This will greatly improve the EMS turnaround times. Typically, EMS would be transporting to a trauma center that was at least 45 minutes or an hour away.
We've been begging for this, so this is a much-needed resource.
Good Samaritan Medical Center is announcing it's been verified by the American College of Surgeons as a Level 3 trauma center.
The levels are based upon the resources available. They're not based on quality. So a Level 3 is not worse than a Level 1. And I think the expectation of all levels is to be of the highest quality.
The process began 18 months ago with the groundbreaking of the hospital's emergency room in 2010.
An investment that was just the beginning of what really has become a significant investment not only in Good Samaritan by Stewart Healthcare, but also an investment in this community. Over $80 million to date.
Good Sam is in the state's Emergency Medical Service Region 5, which covers Barnstable, Bristol, and Plymouth counties, plus the islands.
We are very proud here at Good Samaritan to be not only the first, but we are the only trauma center for this large community of 1.7 million people.
24-hour care will be available for these trauma patients when time is of the essence.
We will assess and resuscitate these patients, and then if appropriate, we have the ability to operate, we have the ability of critical care. We are now a part of a trauma system. We're not an individual hospital, and I think that's what makes this.
Since December, staff have responded to several traumas, including the victim of a stabbing, a child with a head injury, and an adult that came in unconscious after falling from a roof.
This fast initial administration of treatment and medications within that golden hour of trauma is shown to really significantly increase patients' positive outcomes. Long story short, this patient essentially walked out the doors of the transferring facility. Again, with this catastrophic injury, was able to walk out and is fully functional.
We can develop and deliver care that has clearly demonstrated that the trauma patient that enters a trauma system does better. There's no question.
Outside of health, another major benefit for communities, an increase of revenue.
In a smaller community, they may only have 1 or 2 ambulances, and if those 1 or 2 ambulances are out of service for 2 or 3 hours, that certainly puts a big strain on their system. Taking those resources out of their communities for a long period of time, where that ambulance now will be able to turn around much, much faster and get those resources back into that community.
For Bridgewater This Week, I'm Alicia Fortin.